Hello and welcome to everyone that's joining us for the very first session of our virtual McLean County Behavioral Health Community Forum. We are going to give some more attendees a little bit more time to log on since we're just now at 12 o'clock. We have far more people attending today than what our individual rooms can normally handle in person for a breakout session, so we're excited about that. But we will get started in a couple of minutes. Okay. Okay, I will go ahead and kick everything off, knowing that more folks will join. So I want to start by saying hello and welcoming all of you again. This is our first session to kick off the 2020 to 2021 McLean County Behavioral Health Community Forum. As this is the fourth annual event, you're likely already aware that we've made some changes to the forum this year. Most notably by transitioning to a virtual forum. Rather than a one-day in-person event, our forum now spans many months and has sessions scheduled all the way up until May of 2021. This transition also allows you to attend a session while having lunch or possibly breakfast, or even late in the afternoon on some days while preparing dinner or wrangling kids, if that's your life scenario, or possibly even just taking some quiet time after a day at work or helping with remote learning. We recognize that days look different now, and we're in hopes that the virtual format this year, and with only one session per day, helps you be able to attend more sessions than ever before. Even with a different look this year, the idea of free community education and sharing of ideas originated out of the Mental Health Action Plan, which was adopted by the 2015 McLean County Board. This plan originated out of more than 100 community members who identified needs and best practices relative to behavioral health specific to McLean County. The idea of our forum sessions seems even more important now that fellow community members may need information, resources, encouragement, or simply recognition that life can be challenging at times. Ongoing sessions address a series of topics ranging from COVID-19, behavioral health in traditionally stigmatized populations, youth, coping, and more. We continue to seek out presenters for topics that were established with our planning committee, and they are added to our website and the BHCC Facebook page as new sessions are confirmed. So we encourage you to check the website regularly for updates, and we hope you'll continue to join us for sessions throughout the next several months. I want to give a quick overview of some specifics about today's session and all ongoing forum sessions. All attendees are muted. You are welcome to submit questions at any point through the chat feature. Questions will be consolidated and asked of the presenter at the end of the session. With that, it does mean that we request that you identify your question as a fully formed question. So as one example, if today's presenter or any presenter is giving information and your question is in direct response to something said in that moment, and it's, what does that mean? By the time we ask the question at the end of the presentation, there won't be context anymore. So if you could please identify the full nature of your question, that will be helpful at the end. We do have a question moderator for each session. Our question moderator today is one of my team members, Kevin McCall. and he will read the questions to our presenter following her presentation of the session. And so there will be time to answer all of that. I will go ahead and kick things off and introduce today's speaker. So I am pleased to introduce Gaynette Hoskins. Gaynette Hoskins has worked in social services for a little over 8 years. She served as a commissioner on the Bloomington Housing Board and has worked with domestic and sexual assault survivors, those experiencing homelessness, reducing prison recidivism rates, substance abuse reduction, and providing resources to at-risk communities. She currently works as a COVID case investigator for the McLean County Health Department, a family engagement coordinator for Children's Home and Aid, a case manager for Dreams Are Possible, and an LGBTQIA group facilitator for the ROSC. She is a mother of 4 and a grandmother of 2, with another grand bundle of joy coming within the next 5 months. Even as I was preparing information about a bio for Gaynette, paired with what she provided to me, I think it's apparent to say that she keeps herself busy and involved in the community and tied to a number of social service organizations that are also clearly working relative to trauma work. So I am very happy that she has agreed to be our first presenter and on such an important topic. So I will turn everything over to Gaynette.
Hi, everyone. This is extremely weird for me. I think I told Trisha and Kevin that it's kind of hard not to be able to speak with you all as much as to be able to see you all, to get that nonverbal communication or verbal communication. So just bear with me today. We're going to try to work through this the best we can. I think Trisha introduced me like that was a mouthful. Absolutely. My hands are full, but please know that if there is at any time that you believe that I can help you in any way possible or to clarify anything that we spoke about today, please make sure you reach out to me. Also, I love to do a disclaimer. Sometimes we have very hard conversations and very uncomfortable conversations. Please do not hesitate to go take care of yourself if you need to. Sometimes the information can be extremely overload. It could be a huge overload. So just do not hesitate. If you need to step away, okay? I'm going to just start out with sharing my screen. 1 second. Okay, do we have it? Got it? Perfect. Let me get back to here. So today we're going to talk about the intersection of trauma, mental health, and racism. I just want to put out that this is only from what my experiences, my education, and my interactions with other people in the community. I also do a vast amount of research on these topics because I think it impacts us greatly. And I just want you all to know that if there's any time where you have additional information or you'd like to have a conversation past this, please do not hesitate. We are going to talk about a vast amount of things today, and we're going to do it pretty quickly, seeing as though we don't have a lot of time. So my mentor and one of my directors talks to me all the time about me speaking extremely quickly. Let Kevin know if you need me to slow it down a little bit, okay? All right. So what we hope to take away from this presentation is just really to gain a better understanding of the trauma, mental health, and how it disproportionately impacts people of color and just vulnerable populations in general. I think a lot of us have worked in this community for quite a while, and we've actually witnessed firsthand how sometimes people of color are not able to be cared for like we would love for them to be. So we're going to talk about that. We're also going to learn how we can be better allies to helping those experiencing all the intersections, mental health, trauma, and experiencing racism. And I want us to create a healing plan. So during that Q&A, when we're talking, when you're with Kevin, please just make sure if you have any suggestions or anything that you feel like we can do as a community. I don't think any of us have all the answers, but all of us together can create a plan. So as long as we can do that, I think we're going to go great, okay? So defining trauma. I'm not going to read all this off to you all because I think we all know what trauma looks like. I just wanted to tell you how I'm defining trauma when I speak about trauma, historical trauma, mental health, and racism. These are the definitions that I'm going from. So we have the trauma with the emotional shock following stressful events or physical injury. But I like to also talk about like the different types of trauma. So we all know about those small T and big T traumas. Some of those small T's are highly distressing and impacts you as an individually it just impacts you personally. And those can be like non-life-threatening, mental abuse, broken relationships, loss, grief. Those are those small T's. What I try to tell people all the time is I do not like to minimize any form of trauma because everyone is different. And we've also been able to see that those small T's they add up a lot. And can actually be a big T, which is the big T is most commonly associated with a post-traumatic disorder. And that's like threats of life, serious injury, sexual violence, catastrophic events, something like 9/11. And so those are the ones that we're going to talk about as well, seeing how this impacts us and why some of us have it harder to go out and reach out for help. And when we talk about those big T's, we also want to make sure that we add those first responders. Those first responders are more susceptible to experiencing those big T's because they have ongoing exposure to traumatic events almost daily. So we want to talk about those. Then we talk about the historical trauma. And it's a collaboration of both big and little T trauma that impact generations. So much so that just one generation displaced from the trauma can be just as impacted by the trauma as the generation before that actually experienced the trauma. So we're going to talk about that as well. And some of those examples may be like First Nations people. When I say First Nations, I mean Native American populations of people whom experienced slavery, like Holocaust survivors, and women. And I know it's very strange for us to talk about women being in this category, but I think we'll talk a little bit more about that a little bit later. And mental health. So the term truly means, we have a definition here for what mental health means, but to me the term truly only means how we are dealing with life struggles. That's not to minimize what it is. It is, although we usually associate the term with negative or traumatic feelings, mental health can mean positive or negative experiences. Positive mental health simply means the predominance of pleasurable experiences over negative ones. So when we say, how's your mental health, we're not saying that you're depressed or that you're having anxiety. We're saying, like, is it good or bad? Are you having more positive experiences than not? So then we're going to go over to racism. When we think of the definition, we recently discussed like trauma, historical trauma, mental health. Can we see how vulnerable populations could possibly lack trust, understanding, validation, support, and acceptance, and people's symptoms and unconsciously themselves? So it becomes a state of mind. It puts you in a place that believes like you're not good enough. Because you hear it so much. You're socialized into believing you're not good enough. You're socialized into believing that you are to assimilate into a certain culture or a place, and that's not actually accurate, but in your mind it's saying I'm never ever good enough. So those are some of those examples. And then we're talking about the vulnerable populations who this may be impact even more so. This is not to minimize anyone else or their experiences. We are not saying that white people wouldn't possibly be considered a vulnerable population. We'll talk a little bit about privilege a little bit later, but we will see more of the vulnerable populations than people of color, And unfortunately, but fortunately, lately and over the last few years, we have witnessed terror in these communities via the media and social media. We're talking about killings, cagings, mass incarceration, isolation, oppression, reduction of previously scarce resources, and sheer invisibility. However, the terrorism did not just start over the last few years. People of color have been fighting for equal rights since the formation of the United States. And First Nations people would argue that it was even before then. So when we're looking even more closely at the immigrant population, surely we have not forgotten that there are still children caged and separated from their families because they wanted to live the American dream. Women, men, and children being trafficked here due to believing that they will have a better life, being preyed upon. And I remember, like, when I was in college, we talked about the Massachusetts Bay General Court ruling of 1631. And I'm sure all of us did not remember all this, but it stuck out to me because of some of the rules that was made during this ruling. It was just basically stating that if someone identified as in the LGBTQ community, they didn't call it that then, of course, but they could be executed. They could be banished. They could be whipped. They could be all three. So it was actual rules put in place to oppress a group of people. So anytime that we talk about vulnerable populations, we have to make sure that we add the LGBTQ community, especially since just as recently, even though that started 400 years ago, just recently we witnessed the slaughter of people in a nightclub. We are witnessing it every day, and they are still, the LGBTQ community is still fighting for just simple rights to get married, to raise a family, and to live in certain communities, to even go get a cake made. So we even can go even further with our trusted DSM. I know I appreciate it and I love it, but we all know that homosexuality was labeled a disorder. And in 1973, they changed the word homosexuality, and it was removed, but they changed it to sexual orientation disturbance. And right now it's like, so our psychologists, the people that we feel like we could go in and go trust and talk about our vulnerabilities, right then at that time automatically told us that our sexual orientation said that we weren't enough. Something was wrong with us. So we can imagine how one may feel if they felt like seeking help for trauma unrelated to their sexual orientation or sexual identity, and this is what they would have to walk into. And a little bit earlier, I talked about women. I see we have the intersection up here, but I'm saying this because we're looking at it as we go. My apologies. Let me get that back. So women have historically been ostracized, being isolated, etc. Has impacted the way many other women see themselves and other women for generations. That idea has forged cultural norms into our minds and sometimes make us second guess whether we are capable and competent as the male counterparts by us or around us or even in the same room. It pushes us to second guess what we speak on, when and to whom, unconsciously. Like it's not even in our mind. We just sit there and we think over and over again, like, okay, am I going to seem too assertive? Am I going to be too aggressive? Is this going to stop them from including me in this space? And that's not something that, in my experience with talking with other men, that they have to think about. It's considered strength. They're leaders. Women are supposed to be, society will want us to say that we are going to be a little bit more nurturing, a little bit more caring, a little bit more passive. And if any of you know me, you know that is not it at all. So, and I am still all woman, but that is how we have been socialized into believing that strength is more of a hindrance to our personality as opposed to a benefit. So we have that. So now I have this up to here with this intersection. I think we've all seen this wheel, but we never sit down and kind of think about, when we're interacting with clients, how this wheel is impacting our clients before they walk in our doors. So these are our clients, our patients, our students, our friends, and our family. Before they come into or even think about seeking any services, They just said that they weren't enough. I'm going to read this out loud. With this intersectionality is a complex cumulative way in which effects of multiple forms of discrimination such as racism, sexism, and classism combine, overlap, and intersect, especially in marginalized groups. So we talk about like someone coming into our office who may not have the most literacy skills, may experience some literacy barriers. They're probably older or much younger, LGBTQ, female, Black, or Latina, or Middle Eastern, and Muslim. So they're automatically like, okay, this is a problem for us. All these intersections, so they're experiencing racism, they're experiencing ageism, sometimes they're experiencing like just homophobic or xenophobic behaviors, and all of this is what they couple up to before they walk into your office. And then we automatically say, oh, they came in with the attitude, or they're not really engaging in their healing plan or trying to provide their resources. They're not giving me enough information to be able to support them. And it's like, well, do we know what they actually had to go through? And all of these are things that are socialized into us. So sometimes they don't even understand why they're so upset, why they come into the office extremely frustrated, why they are reluctant to give you information. And it's because they're worried about being judged. Ideally, and according to most of our teachings, we know that they say that the ideal person is white, Christian, heterosexual, able-bodied, married, male, financially well-off, and between the ages of 25 and 35. 55. Like, they are set. This is good. This is what our country is built on. Like, this is who we would look up to. Anything beyond those characteristics are considered intolerable, or outside of the norm. Or I wouldn't even say intolerable. I think we are a whole lot more evolved than what we were in the past. But in my experience, I have definitely sat with a counterpart or sat with a client to go receive services. I'm only sitting with him as an advocate, and they would speak to him, or they would speak to him and not speak to me, even if I directly contacted them. They would unconsciously sway directly over to him as opposed to speaking to me. And I get it, like unconsciously this happens, but this when we talk about implicit bias and learn a little bit more, we have to do a lot of self-awareness. So this overlap is a lot of the reason why a lot of our clients experience trauma over and over and over again. Those small T traumas coming directly into a big T trauma and preventing them from feeling like they would like to reach out for resources. It's like, for what? At this moment, why should I? What am I going to get out of doing that? So now we have to talk about why people of color aren't seeking help. Just because I'm a person of color does not mean that I can speak for every person. I can only go off the experiences that I've had with people in the community, my family, and me personally, and from research that I've done. And a lot of the time, this is when we're going to have the real big conversation. It's about recognizing the trauma. How do you recognize something that has been passed on to you from generation to generation? You notice that your grandfather, great-grandfather, or grandmother drank all the time. You were hit repeatedly for the smallest things, and even just hit in general. You didn't even realize how much that impacted your life. And then you found yourself in a bad relationship. That first relationship, he physically hit you. This next relationship, he only yells. You've already been desensitized from your growth, from growing up, from your home life. So it doesn't seem so out of the way. So you can't even recognize that these small T's and sometimes huge T's are traumatizing you. And I don't know about you all, and like I said, I can't speak for every person of color, but more often than not, we were raised with that. What goes on in my house stays in my house. It's about not putting out too much information because people will judge you. They're going to come and take you from the house, so on and so forth. So if I have this in my mind that I'm not supposed to tell any of this information to anybody, and then it happens to me so much so within my household, how can I recognize that it's even traumatic? I can't. It's just something that goes on, and we know about that somatic nerve, that fight, flight, or freeze. It just stays up, and people are already on edge, hypervigilant, hypersensitive, and that's just coming from generation after generation of experiencing those small T traumas. And sometimes you add in a couple of those big T traumas, and it's a whole mess. And I think a lot of us have been working on looking at those ACEs. Some of us have did our actually scored ourselves and looked at those numbers, and we feel like we're in a good space. Just imagine some of the things that a lot of our clients or patients or students have to go through. Triggers without warning. So I put this here because I have seen this happen so much so while working with clients and every capacity. Those triggers without warning cause them to yell in our office, slam stuff, refuse to take your call, everything. It's because we said or we asked something of them, and they either did not have it, did not feel capable, or it was just too much piled up, and they would trigger so easily. You would be like, I didn't say anything. I just asked you, do you have your birth certificate? Not knowing that their abuser took the birth certificate from them, and they're still in court over order of protection or something like that. So it wasn't you asking that question. It was all of the stuff that added up to that question. So to prevent that, a lot of times people will refuse to go out. I don't want anybody asking me anything about my life. I have enough. I have to deal with it on my own. No one cares. Compartmentalizing. We see every day that I know from working in sexual assault and domestic violence and just working in the community in general, it's a huge overlap. We have people in our own agencies that are experiencing domestic violence at home, and they are trying to set it to the side so they can work. They're experiencing trauma at home or in their communities, and they're trying to do it. Still trying to make sure that they're working. But the only thing is, it's 5 to 6 other layers on top of that. What if they're Black? What if they're a woman? What if they identify in the LGBTQ community? It's overlapping. So for them to come out and tell you all of this, it just seems like they're broken. And I don't know if you all can see me, but I have these quotation marks in the air because that is so inaccurate. But that is the mind frame of so many of our community members. I am not going to tell them everything because, number one, I don't want to be judged. Number two, if I say it out loud, it's real. And at that moment, you really don't want it, because once you acknowledge that it's real, you have to do something about it. It's going to nag at you all the time. So it makes sense for them to work is work, home is home, school is school. This trauma is this trauma. I'm not going to deal with it. This trauma is this trauma. I'm not going to deal with it. It just makes so much more sense. The reluctance to seek resources and support. I think, just like I said, from working in a domestic violence, working with domestic violence survivors so many times, we was able to see that someone would tell you, I tried helping you and you don't want the help because you didn't do exactly what I said. So my thing is the same thing. We've all done it. Like, I have to say that I'm guilty of it. Like, we have this term in social services that I have definitely changed my mind on, and it's I can work harder than my client. And then when you think about everything that your client could possibly be going through, it is absolutely no way that you could. If you went and took all the groceries, did all their case notes, did all their paperwork, and went and collected all of their personal identifying information to put in that file, you still didn't work as hard as they did. They had to go through the trauma. They are still experiencing the trauma. They had to get up out of the bed to go deal with that trauma. And then they had to tell somebody about everything that they experienced. They had to come and ask you, someone else that they don't know, about a resource and you automatically say, well, I'm not going to work harder than you. If you're not going to help me help you, it's nothing that I can do for you. So it makes people way more reluctant to reach out when it is so many different layers and so many different ideals about how one of our participants or our whoever we're providing services to, how they should present. They're not going to go out. And then if we have a negative interaction at one agency, oh my God, they don't just put it for one agency, everybody. They speak, a lot of us, all of us, most of the time will speak in absolutes. I catch myself all the time. They always, or I never can. We speak in absolute. So we have to believe that all of our participants or people that's receiving services from us, our clients or students, they speak in absolutes as well. So you have one negative interaction with a service provider, you better believe that is going to be transferred over to almost every person that they have until they have a positive and repeated positive ones. Because again, we talked about those big T's: small trauma, small trauma, small trauma, big trauma. No longer do I see you as a safe person. And then communities with trauma for the greater good. So I know a lot of people may have heard of this before, but what they say, what's the saying? Hurt people hurt people. It doesn't, if I'm able to heal, how do I identify with the rest of the people in my life? Most of the time, small groups, small communities really have a couple things in common and a whole lot of different things that they do not relate on at all. Those couple things that keep them connected to that community is what they feel is best. Why would they heal from it? Especially going to step outside of that community and risk the chance of not getting the support and unable to go back to the communities that they feel most comfortable in. So then we have this, how do we heal? A little bit ago, I talked about this ideal person, this who we in the world would consider someone who has the most privilege. That's not to say that they still don't have problems, they don't experience grief, that it may not be a little bit harder for them, but that's just ideally, this is what it is. I do understand my privilege. I have my master's degree. I own my own home. I have 4 jobs. I better have $1 or $2. I have my kiddos. I have custody of my kiddos. Yes, I am Black, lesbian, but I have so many other privileges. I'm capable of filling out. I'm competent. My age is decent. We're not going to talk about my age today. So I'm at a good age. My appearance, I look fine. You cannot tell whether I'm LGBTQ or not. You can't tell what my religion is. You can't tell anything. I have a lot of different privileges, but I have some places where I'm not privileged. I am a woman. I am a woman of color. I am a single woman of color, and my socioeconomic is not where most would want it to be. I also am not a Christian. So I have a lot of places where I lack that privilege, but I think it's good for us all to be able to do that check-in. How am I privileged, and how does this impact the way I interact with people? And then it's also, how can I use this privilege to help other people? It's just really being honest with yourself. So when we think about that trauma, we can't say oh, well, my clients, I heal from my trauma. They should be in a better space because I was able to do so. We cannot believe that. We have to recognize that we have different resources that help us along our healing journey when other people may lack that, or they actually can't recognize that their resource is available to them, or they don't trust that their resource is available to them. Understanding and respecting our differences. I think a lot of the time, I hear it all the time, I don't see color. I have a lot of friends that are Black. They're my best friends. I have children by a person of color, whether that's Latinx, whatever, Black or whomever. I can't be that's not that's not it. That's not how you respect the difference. What you're basically saying is what my color or my nationality or my religion, oh, I know a lot of Christians, I know about this, like, it doesn't matter. What it's saying is, this is mine and this is yours, and I respect it even if it differs. And usually when you can find those differences, you can find the commonalities in those differences, so much so. If we can just learn a way to try to find a way to include instead of exclude, I believe that we will be in a place where we can get more people to reach out and discuss how racism, trauma, and mental health kind of overlap. And once we can have that conversation, we can get more people in receiving services to get some of that stuff knocked down. I'm not saying that there is no racism, but a lot of times we believe that it's a racist space, especially if it's predominantly white. You don't know how many people in there are going to accept you, how many people, like, if we have all those positive conversations, all those positive connections, like we talked about with that somatic, having the positives to outweigh the negatives when we discuss mental health, it minimizes how horribly we see the world. And it's our responsibility to do that. So we have to respect those differences, speak and confront those differences even when it's uncomfortable, and then go ahead. So and then move forward. So then we talk about actively listening. Now, when I say this, I know we all know what this means, but I don't want us to go from the definition. I'm going to go from the place of being a service provider, also being someone that had to reach out for services. Sometimes we have the propensity to listen to get the information that we need, or listen to respond. And I'm not saying respond negatively. I'm a social service, I'm a social services, social work, so I'm a social work major, and it's always affirm, validate, support, empathize. Let's do this. It comes off a little bit robotic because the books told us to do this. We practice this in our mock interviews. We've been practicing our whole time. So when they say, I don't feel well, I can see how you don't feel well. Tell me about that. Like, it's robotic, it's disingenuous. Actively listening, if they say I don't feel well, they are going to tell you why they don't feel well. We don't have to prompt people. Like I said, it comes off disingenuous, and it prevents people from feeling like you are a support person. And this is not just coming from me. This is like, I've heard this so many different times. We have to actively listen. We have to actively listen to our people in our community, and then move from there. Just not with a plan to fix, a plan to actually listen. Not with a plan to validate or support. Of course, we're going to do that. With a plan to listen. Sometimes, and they always told us when I was in school, self-disclosure is not good. Your clients or your patients start to feel like they have to take care of you more so than anybody else. And I'm with them on that in a certain way, but then in the other way, like, when you can self-disclose, when you can be open and vulnerable with your people, when they can see that you may not understand fully what they're doing, but you care enough for them, or what they're going through, but you care enough for them to say, I'm going to sit back and I am going to be a passenger, and I'm going to let you know that I'm open and I'm vulnerable to you, and how can I help you? And sometimes what they always say, the best way to teach is to learn is to teach. At that moment, they get to tell you. And once they're telling you, they're learning. So you're learning from them. They're teaching you about them. And that's you basically saying, I am not the expert in your life. I am not empowering you, which is a whole nother other issue. I talk about this all the time. We cannot empower someone to do anything. Like, we are not the spirit gods or anything. We can provide the tools to empower. So when we're asking someone, or we're telling somebody that we are empowering them to do better for themselves, we are saying that without us, they are not empowered. Without what we have for them, they are not empowered. We are saying that we are providing the tools to help you empower yourself. And I know that's very different than what a lot of us have been taught. It's always you empower your clients, you empower your team, and you cannot, like, because that's saying that you actually have the power or the control to take it away or pull it back. And that's not how we want it to be. And that's not us actively listening. That is us, again, trying to find a way to resolve. Community buy-in. So it can't just be about us as providers saying, I'm just going to vow to do something different. That means you have to get way more people. If I need to bring 10 more people in and say that I'm going to reflect on how I'm interacting with people of color, I'm going to be mindful of not just people of color, everyone coming into my office to receive services or resources from me may have multiple layers. They may have multiple layers on them, and I'm going to hold the people around me accountable. At that moment, when they see that you can stick up for them, when they see that you're advocating for them, when they see that all of us have a genuine care, the community begins to buy in. We won't have to worry about people of color reaching out, because it's not just one or two people that they feel are safe people. It's not one or two people that they like, this is a good way for us to start doing things. No, it is 5 to 10 people, and then 20 to 30 people, and then 40. Before you know it, the whole community is bought in. They feel like every person that they interact with is a safe person. The only way we can do that is by holding each other accountable. Always being able to debrief. Sometimes we have some hard ones, y'all, and I promise you, I have. I'm not saying that it's easy, but I'm saying that we have to be intentional. And then celebrating small successes. A lot of the times we get so worried with our grant numbers and our reporting, and we get this pressure. We got an influx of people coming in, or we don't have enough funds for all the people that are coming in, and it gets so overwhelming. If you're not okay, the rest of the community won't be okay. So we have to celebrate those small successes with ourselves and then with our community. And I think that is the only way that we are ultimately going to be able to heal all the way around. So when we talk about the racism, the mental health, and mental health, and the trauma, and trying to get all those intersections, to get them to an office. And I talked a little bit about this at the WGLT interview. We talked about, like, why is it so hard to get people into our offices when we know they need the resources? We would have all this money left over. Like, why didn't they reach out? What is going on? It's because we talked about, it's not enough people of color. It's not enough people that they feel like they can relate to. We have to find a way. You can never be a person of color if you're not a person of color. We can't ask you to, we can't ask you to try to relate to them on that level, but there are so many other ways that you can. We have to find ways to get it where the people of color feel comfortable reaching out to us. And that is going to be the way that we heal. They're not going to automatically feel judged, because we are going to provide positive interactions for them. They will not automatically feel like they aren't able to enter our doors, or they're not accepted, because they will see more people like them walk into our office and be accepted. So we just have to make sure that we are intentional with doing that. And I honestly believe that this is the way that we will heal. And then we always say, like, well, that's a big ask. Like, what do we do? How can we help? It's ask, listen, and then assist. This is just my motto, because I think it works well with me with working with community members. Sometimes people do not know what they need. For you to ask them, how can I help you, and mean it, not just how can I help you? Great. Like, how can I help you? What can I do to change one thing that's going on in your life right now? What can I do? What am I in a position to be able to do to help you? That ask right there, like, sometimes they like, wait, what do you mean? It doesn't even resonate to them, because nobody ever just sat there and asked them, like, not how can I help you? Like, it's what can I do right now? Let's try to see one thing. Is it a bus card? Is it a hug? Like, we know that's not always acceptable, of course, but is it a hug? Is it a, like, do we need to make a phone call to someone that you were trying to get resources for? How can I help you? Let's try to get one of those small successes done, even if that's just you being heard today. And listening. We talked about this, that active listening, but actively listening to, not to help, right there, or not to validate, to actually allow them to be heard, and then assist the best way that you can. It does not have to go, it doesn't have to be something big. It doesn't have to be, you may just assist by providing a warm handoff, an ear, or just being able to say, like, if you're having troubles in the future, do not hesitate to reach out to me. At that moment, they feel like they have a support person. How do we start to heal with the trauma, the mental health, and racism in our community if people of color are not seeing this? And I hear this way more often than not, and I'm sure a lot of you all heard. They do not feel heard. They feel judged. Automatically, they felt dismissed. They didn't feel represented. These are things that we can change altogether. We can minimize those small T's that they're experiencing. We cannot stop it. But we can minimize the impact of it if we're able to interact with them. And the only way we're going to be able to interact with people, with the communities of color, is if we are more open and more comfortable with being uncomfortable. And so that is basically all that I have right now. I'm going to open it up for Kevin for questions. Let me.
Sure. So again, if you have any questions, could you please just go ahead and put those in the chat box now, and then I will relay them to Gaynette to answer.
And I'll take a moment to thank Gaynette for her presentation and sharing so much information with us. I think it is such a good reminder for all of us to keep in mind on a continual basis that the people we interact with, especially when we're talking about people of color or people in traditionally stigmatized or more vulnerable populations, are interacting with us with a cumulative experience of trauma. And whether that is big T trauma or little t trauma, people are interacting with us, whether it's in line at the grocery store or whether we're in a helping field and they're coming through our doors, or whether it is our neighbor or the person pumping gas near us. They all have a different experience, but they're all coming with a cumulative impact of that trauma. I want to pose what I recognize may be a difficult question to Gaynette, but I wonder if, so near the very end of your presentation, you talked a little bit about minimizing the impact and sort of the hurt when we can actively listen, when we can ask questions, and we can really be receptive to the needs and experiences. But I pose sort of a hypothetical question to you of, do you think we can begin to reduce some of the trauma in people of color and in different cultures that are living within our own community by being more mindful and listening more actively and trying to really hear what they're bringing to us? Do you think that can have a bigger systemic change down the road, even if it's not in the immediate generation? Does it have an impact on the next generation? So I guess that's sort of my hypothetical question to you of, do we not only minimize, but is there potential to start to eliminate some level of trauma?
And I'm really glad that you asked that. I know it was a hypothetical, but I still want to be able to speak on that. And I think you're absolutely correct. What we do is, we talked about that a little bit, like the more positive, when we talked about mental health, the more positive, it's saying that your positives are outweighing your negatives. So the more positive interactions we have, the more open they will be to taking in the information. So if I'm concerned about a person, like just say I did domestic violence. I worked with some domestic violence survivors for a while. 7 to 10, it would take 7 to 10 times for them to leave before they actually left. 7 to 10. Every time they came, they learned a little bit something different from us. They trusted us a little bit more. They found that they found worth within themselves. They started to challenge or reframe the way they thought about themselves. And every time they was a little bit better and a little bit better. Absolutely. The more positive interactions, the more we can actively listen, but the listen to hear, the more people will reach out, and the less traumas, the less that we will be able to educate them, because now they trust us. So when I tell them, like, hey, I know you want us to set a plan. We started some SMART goals for you. This is that, this is that. If they don't have a rapport with me, if they don't trust me, nothing's going to be done. If they have that rapport established, and we've had so many trusted interactions, or they've had enough trusted interactions with people like me, they're going to get right on top of it. They're going to reduce how long they stay in negative relationships. They're going to reduce or increase their financial literacy, reduce how their output. They're going to reduce their crises because they will already have skills. They can't take in skills and tools from you because they're not trusting us. And we have to do that. We have to begin to start those relationships with trust.
Okay, thank you for commenting on that. And, you know, tying into that, it makes me think of some of the research that I've read about what really impacts the therapeutic relationship, and that it's not always so much about the approach that the therapist takes, as in it's not necessarily CBT or DBT, and those things are worthwhile, but that it is really about the rapport and the relationship built between the therapist and the clients. And we're not just talking in this conversation about therapy, but tying into what you just said, that importance of the connection of trust, and that's important. And I would say, I think that's important for those of us who are white or with privilege, to recognize that we need to also be people that can be trusted, and asking the hard questions of how do we exemplify that. We do have some comments and some questions that are coming in, and I will throw one out, and then I'll probably pass it over to Kevin to allow him to do his question moderating. But one of the first ones that came in is, if a person is under undue stress, approximately how long may it be before mental health signs appear?
Oh, like I'm actually not a psychiatrist or a psychologist, so I wouldn't be able to guesstimate. But the thing that I know from working with people in the community and working with people with extreme traumas is sometimes it's never gone. Those survival techniques, we call it manipulation. They try to take funds from us. They're negative when they interact. It's there, it's always present. So most of the time, it never goes away. But when you're thinking about mental health, as I think a lot of us have been educated in that, like you start to see, and they always say 30 days or more. The DSM always tells us 30 days or more, but you can start to see a difference. When I was a sexual assault survivor, I can tell when one of my clients were regressing because there was no more progression. Even if it was a standstill, they weren't going forward when they ultimately were. So I think that would be the best way for me to be able to recognize. And then good for you to talk to like a psychologist or someone who will be able to help you even more so. But that would be my clue. It's just being able to see it's no progression.
Okay.
Okay, we have a couple questions in here now. I have one from Mary Campbell. It says, what can people do to create the environment in their space that increases a person's comfort as they enter one's office, agency, voicemail, messages, etc.? Essentially, what can we do to decrease the fear or lack of trust as they enter an institution for help?
I think just acknowledging it. I think it's really good when if I talk to a person that is like totally different from me, I would just acknowledge it and say, hey, I know you don't know me very well. We haven't established a rapport, and you're going to tell me some very hard things. What do you need from me to help establish this trust? Because we need to get things done, and I want you to feel like you can trust me. What do you need from me? And I think that's asking each person individually, and I do it in every session, even at work, Miss Mary. I do. So I ask every person, like, what do you need from me? Everybody is going to be different. You have to ask. They have to feel like they can kind of steer that bike a little bit, or it's not going to work. We can put up all the flags and signs that we want, but if you aren't asking them, hey, how do you identify? What are your pronouns? How do you identify? What would you like to be called? Things to that, like just being able to say, like, I'm open to whatever it is you need me to do to make sure that you're comfortable, within means, of course, but I'm here. And I think that's the best way, just being able to ask, like, and acknowledge we're different, and that's blatant. But how can we find those commonalities? What do you need from me to make sure that you trust me?
Great. I think this next one, you may have answered a little bit of it. This is from Erin Oskins, but again, it says, what are some tips to break those barriers that trauma has created? So specifically, she says, as an educator, I have a hard time reaching some families that have had past traumas relating to school and educators. So what are some tips for maybe educators specifically?
I think like you said, we kind of answered that. It's acknowledging it. Sometimes I was on the Heartland Head Start board. Are you guys getting a lot of reverb? I'm not sure what happened. Is that better?
Kevin, you may need to mute yourself while Gaynette is speaking. I'm wondering if that might be the feedback.
Yeah, I should be muted now, so go ahead.
Okay, is that better? Can you all hear me? Okay. Well, I think, like I said, I was on the Heartland Head Start board, and I was speaking with people, and it would say, well, our parents they don't care. They'd rather be on Facebook than to interact. They don't attend PTA meetings or functions, but they'd rather go out. So when we have these ideas, they've interacted with people that actually believe this. So they've had so many negative interactions. They don't want to tell you that I work all these different hours. Sometimes I'm so tired that I can barely get up and feed my kid. I don't really have the transportation to get out to come and see you or come to that meeting. I feel bad once I get on that phone because I know I was supposed to call you. I think just being able to, again, acknowledge, like, I'm here for you all. And sometimes we say that, but it doesn't seem as genuine, especially when you go in and you go back and say, you did this wrong, this wrong, this wrong, and your kid did this wrong, and this wrong. So it doesn't always seem like you're the best, even though your job is super important, it doesn't always seem like you're the best support person. I think being able to acknowledge that, like, this is a whole lot for you to deal with. I can't imagine what you're doing at home. How can we help you to make sure that your child is successful? And boom, I think that really opens up the door a lot. It helped a lot when I was doing it on the board.
And Gaynette, I wonder if I can get your thoughts, because as you were answering that question, it made me think back to a time when I worked with and interacted with a family of color, and there were a number of barriers and a number of past traumas. And so I'm going to pose the question to you to get your thoughts and wonder if this may also help with some insight to Erin, who asked the question, which is there a benefit to educators or anyone in the school system asking families what barriers they're encountering, paired with recognizing that, I mean, this goes to your ask and listen, but really hearing and believing that what they're talking about is the truth. So the family that I mentally thought of as you were answering was a family where transportation was an issue. The public transportation system didn't actually go near that particular school. This individual didn't have a vehicle. And there continued to be barriers and difficulties simply as a result of transportation, where if there had been dialogue in a different way, I wonder if it could have been approached differently. So I wonder if you think there's advantage to folks in the school system or any other system simply asking an individual what barriers they're facing and how they can help.
I think if that rapport is established, then it's really good. But a lot of the times, as we know, most of our at-risk communities have either had some interaction with DCFS, a negative interaction, or it's been a threat that there will be some DCFS. They don't understand that DCFS can help them. They don't understand that there are positive services there. So initially, especially through the school, they may be very reluctant if you all don't have that relationship. If it's going to be hard for them to come and say, he beat me or she beat me and took all of my money. I can't find the car keys. The baby hasn't, he took all the money. I haven't been able to wash any clothes. They aren't going to come and tell you that because immediately I can't go through all this and lose my kids. Automatically, they feel like DCFS is coming and they're going to take the kiddos away. So it's going to be, I think, establishing that rapport is going to be the biggest thing, and being able to tell them if there's a time when I have to make a call in regards to anything, we're going to do it together. It would never be behind your back. It would never be like, tell me what you need, and then educating them on services, because that is usually the reason why they don't disclose. It's judgment and worrying about whether they're going to lose their kiddos. And I think that is like the two biggest things ever that in my experience with working with the community. I'm not going to say anything. I already had a case and I'm not doing it again, because this time I probably will never get my kiddos back. So that rapport and that disclaimer, like, you may have to tell me some things and I'm going to listen. We may have to cry together. I'm going to find resources. Some things I won't. But if anything, if at any time, I'm going to make this call with you. And I think it opens them up, because they like, she's not going to do anything without me knowing. So she didn't call them in regards to this. I think that's it. That's working for me.
Okay, so I have a couple questions here next that are pretty similar, so I'm going to try and combine them, and I think you may have answered them a little bit already. But the first question is from Linda Mosage, and it says, in a limited time interaction, what is the single most effective technique to establish trust? And for some background, Linda says that she is a hospital chaplain intern. The second question that I think is similar in nature is, what are your suggestions for the lay community to establish rapport and have marginalized persons trust? And that question is from Judy Buchanan. So both of those about establishing trust.
Really quick interaction. Sometimes we see our clients for one time and never see them again. But you want to make sure that they still feel like you're a trusted person. I think just being genuine, being knowledgeable, and then being open with what you don't know. It is for you to tell a client, you know what, I honestly don't know. No one ever posed that question to me. Let me go get that figured out for you. They start to trust you because you're not saying I'm the know-all of know-all. I'm not the be-all of be-all. I'm coming to you. I'm a human being. I just so happen to work here. I could be on your side tomorrow. I could be on the other end of this situation tomorrow. Just being as genuine as possible helps you establish that rapport and creates one positive interaction for them to negate one negative that they had. So even if you don't see it instantaneously, you are laying a platform for them to eventually trust somebody else because of that positive interaction.
Okay, great. Our next question is from Elizabeth Balk. It says, how can we increase word of mouth resources to those in need? Maybe I have a blind eye, but wondering how we can get it more out in the community so that someone doesn't necessarily have to build up the courage to go to a location for resources, but can see a number to call or pick up a pamphlet or something like that.
I always refer right over to PATH 211. Like, man, I wish that database was in my brain. What it is like, it's going to be very hard. I personally, like I said, I refer out to PATH and I speak to anybody that I can about resources. So the more people the more people you talk to, the more people are knowledgeable and the more people they'll talk to. And then I always tell people, if all else fails, PATH. If you're looking for a resource and you don't feel comfortable asking anybody, you don't feel comfortable going into any office, call PAF, call 211. You won't know who that is on the other end. You can get your resource and determine when you want to reach out to it, reach out for that resource. So I think that's just my best suggestion.
All right, excellent. Looks like we just have 2 more questions here, so we'll probably get them all in the time here. The next one is, and this one's a little bit more specific. There are many resources and outlets to help evolve our ability to speak well and to express ourselves effectively. What kind of practices and/or exercises do you recommend to help grow our ability to actively listen? And that question is from Hannah Russell.
I'm gonna say this the nicest way possible is just be quiet. Like, we just have to be quiet and not think about anything else but what's being told to us. It's not a technique that needs to be implemented or something you're gonna have to learn. Like, I'm a talker, as you can clearly see. So sometimes I have to gain that. Sit there, be present, be in the moment. When they talk, and like sometimes I have to say, like, in my mind, I was like, wait, did I just hear what I think I heard? And then I have to get present, be intentional with being present and being quiet. And if you need to, take some active notes in your brain, but not too much, because you're gonna be displaced from the conversation. Just be quiet and listen and ask questions. If you think you heard something wrong, if they say, oh, well, let's see something that I heard that was so weird one day. It happens so often. It was a term or something that was used, and in the back of my mind, I'm like, what are they talking about? This sounds like it's gonna be somebody coming through the door to slaughter. And no, it was like a term of endearment. So just going back, like, I remember you saying, like, we all know about that. I remember you saying so on and so forth, like getting clarification, so you would better know how to assist. But for the most part, be quiet. That's all we can do.
Oh, that's great. So we have 1 question left, and this question may have been at least partially answered from some of our other ones, but this question is from Sonia Reese, and it says, as a non-professional in this field, how do I deal with someone who has a difficult situation but is unwilling to seek professional help?
Well, if they have a difficult situation and they are unwilling to seek professional help, you are their trusted person. You are their support person. If they have all of those barriers and you are the only one that they're talking to, right now you are a very important person and you should feel extremely privileged. Everyone has to reach out and deal with services at their own time and on their own time. If you push too hard, you no longer become a trusted person. They feel like you're controlling them and you're no better than everyone else. Continue to listen. Now, always provide education, like, well, you know, whenever you're ready, there's a resource here, or whenever you're ready, we can talk to this person, but always making sure that you're putting it in their hands to be able to steer. Because the moment you're like, well, you got all these issues and you're not reaching out, there's nothing else I can do for you. You're no longer a trusted person. You was probably the only person that they trusted, and now there will be no one that they trust.
All right.
That's excellent. A lot of pressure, sorry, but that's a lot of pressure, but it's real. All
right, that looks like the end of our questions there. So I'll pass it back to Tricia real quick.
Okay, I will, before I wrap up, I will say that there were a couple of just positive affirmations that came through the chat feature also. So to you, Gaynette, you also had some positive feedback about a superb presentation, people affirming that sometimes you just have to show up and it's your actions that convey that you're trustworthy. And then I'm going to go back because there was one kind of early on about really affirming your comment about not being able to empower others. You know, that the actual comment was, I appreciate how you framed, we do not empower others, we are providing the tools for them to empower themselves. We are subliminally reinforcing that they cannot feel empowered on their own by saying, I want to empower you. Good point, thank you. So I want to thank you, Gaynette, for taking the time to not only today, but in the preparation for today, to bring your personal experiences, your expertise in the field, your interactions with other people within our community, all to light, to share with the community and everyone who attended today. I also really want to thank everyone who attended today. Again, I said this at the beginning, but in my mind, it's been really exciting to see that the number of people who can attend one session virtually is greater than what we can do in person in an individual breakout session room. And while we know that cognitively and intellectually, it's also really exciting to see, because that's one of the things that we hoped to accomplish by going virtual this year. So Gaynette, do you have any final parting words for us, or anything that you, any even just really important point that you want to drive home and make sure we all hear before we wrap up?
No, I just want to thank everyone for being here. I understand that this is a very hard topic and not always easy for us to discuss. So I just appreciate everyone just saying, like, I'm going to hear, even if I don't want to hear, even if I don't agree, I'm going to be there and I'm going to support. And I think that's just amazing. Also, like I said, every person of color is different. These are my ideals from my experiences and my education. Make sure that you're asking the people around you what they need. It could be totally different than what I need. I just like to provide a little bit of information that I've collected. It's not saying that I don't need more information, because we all need a little bit of education. I am a forever learner, but making sure that you're open and ready to take in whatever is being taught, even if it's different than what you believe things really are.
Yeah. All right. Well, thank you again so much, Gaynette, and to everyone else who attended. We have so many continuing sessions coming up between now and May. Many of them are already scheduled and confirmed with our presenters and are on our website. So I do hope that you will check that out and join us for future ones. If you want a recap of this one, this particular webinar will be uploaded sometime approximately next week. The link to it will be from our website, but we'll also push it out via social media so that you know where to find it. But again, thank you all for coming and have a great rest of your day.
All right. Bye-bye.